Hello and welcome to the presentation on We Don't Talk About Sex, We're Asians by Dr. Marta Tara Lee. Just a quick reminder before we get started, this session is a pre-recorded presentation. If you have any questions during the presentation, please type them into the question box in your Any Meeting Control panel. I'll send them to Dr. Lee. Dr. Marta Tara Lee is a relationship counselor and clinical sexologist. She provides relationships and sexuality coaching and counseling for individuals and couples and conducts sexual education workshops. She is also the host of the weekly radio show Eros Evolution. She was recognized as one of the top 50 inspiring women under 40 by Her World in July 2010 and one of the top 100 inspiring women by Cozy Cot in March 2011. Here is Dr. Lee.
Hi everyone, this is Martha. I'm a clinical sexologist and relationship counselor, and I'm from Eros Coaching. And today I'll be sharing with you a presentation on sexuality. And so let me just turn on this screen. Okay. So the title is We Don't Talk About Sex, We're Asians, and this is as part of Managing Elderly Care, a conference that's happening in March 2019 in Manila. And these are the objectives of today's session. We'll be talking about understanding, hopefully through this session, you can understand the importance of sex and sexuality for your patients to begin to overcome your sexual inhibitions. And as for myself, a little bit about myself, I have 4 degrees, including a doctorate in human sexuality and a master's in counseling, and many other trainings, sex therapy, counseling, and life coaching. So I've been in practice for 10 years in Singapore, and I've worked with all kinds of nationalities, race, religion, cultures, and of course, not just Singaporeans, Asians, and expats as well. People who are based in Singapore or traveling through Singapore. I've been very fortunate to have the experience of working with different kinds of people of different backgrounds, but especially Asians. In today's session, this 20-minute webinar, I want to talk about why sex is important, why we don't talk about sex, and how you can begin to overcome your sexual inhibitions as a healthcare provider. And also to begin talking about sex with your patients if you're somebody who works directly with your patients. Sex is important because difficulties in sex can have an adverse effect in your relationships with people, in your primary relationship with your romantic partner, sexual partner, namely especially your spouse, and also affects the quality of your life. So instead of seeing quality of life as being functional, we need to be looking at sex in a bigger perspective as part of our sexual rights. And this survey in 2004, it was very clear that sex is important to many of the patients who were surveyed in 29 countries. A lot of them saying that sex is extremely, very or moderately important in their lives. Since this is important for so many people, we are doing a disservice to our patients if we don't bring up the topic of sex. And this is not something that is included in the protocol. It is important to include questions around sexuality and not make assumptions just because a patient is getting on in their years. As a society, we don't talk about sex because we're embarrassed about it. We may have we may not know much about sex, and so we don't know how to bring it up. We are ignorant. We don't know how to ask. We also fear that if people ask us questions, we may not know how to answer. So all these can contribute to further inhibitions, because if we're uncomfortable, the patient can tell that you're uncomfortable. And so then who do they go to instead? Then there's also the concern of becoming aroused or uncomfortable, as if this is very, like it's unprofessional and we don't know how to deal with that. So with more practice, it's possible to not see ourselves in only romantic sexual roles, but be able to talk about sex with a straight face and not see this as something that is too personal, even though it's a very personal subject, but we are dealing with people with personal lives as well. So it's important to differentiate that in your head. Concern about appearing seductive or intrusive, and coming across as inappropriate, like for instance like a slut, and so you are afraid of being the recipient of harassment. So there are protocols in your hospital or practice that you can implement and look into. Uncertainty about legal issues, so to get familiar with the policy of your hospital, of your practice, and time constraints. So this is something that's very real for a lot of doctors that I already know of. It's not that they don't care about their patients. It's also not that they don't want to talk about sex. It's that they know that once they start, it may be very difficult to get their patients to leave, because they are really busy, right? They have many patients waiting outside. So this is something very real. And so with some planning, it's possible to leave some of that to the nurse to support you. And of course, the nurse themselves have to be prepared for this role and how important this role of supporting patients in this way is. So these are some questions to ask yourself if you want to start looking at, are you really prepared to support and ask questions around sex to your patients? So what qualities and behaviors do healthcare professionals need to consider? This is not just about you per se, but about the industry as a whole. What is actually happening in the healthcare profession in your part of the world? How can we as a community support patients? What is already happening, and how can we do better? How do you feel that our as in not just you, but our as in our society, Asians in particular, our personal beliefs and experiences inform or interfere with this aspect of our work? So it's important to look at understanding yourself first. So to begin to overcome your sexual inhibitions, I have a few suggestions to make, four main points in fact. The first one is starting to understand that sex is more than just sex. Often when we think of sex, we think of sexuality and health as if as long as everything is functional, it should work. But sex is not just about the parts working. It has also to do with your acceptance of yourself. Say for instance, your sexual orientation and gender identity. There are people who are not in the majority. They don't identify as heterosexuals, and there's this assumption that everybody must be heterosexuals. And so these people who don't feel comfortable with who they are may have difficulties with expressing themselves. And so as practitioners, we need to understand that people come to you with different sexual behaviors and practices. Everyone are individuals, and their behaviors and practices may not be in alignment with who you are, with your upbringing, with your religion even, or culture. However, it's really important to understand where we come from. We come from a place of wanting to help people, and by helping them, it doesn't mean that we necessarily agree with what they're doing. We don't have to personally agree with it, but we do need to put on our professional hat and become comfortable with all aspects of sexuality, including sensuality, being comfortable with all five senses, and also intimacy, the sense of closeness that people feel when they engage in sex. So it's not just a physical act. There are lots of ways to be sexual with someone without necessarily penetration being involved. For instance, hugging and kissing can be forms of intimacy. So in order to become more comfortable with supporting your patients, you first need to understand sex is more than just sex, but also begin to see this as a process of practice and research. We cannot know everything, and we should not pretend to know everything. And it's perfectly okay to say you don't know something, and you will go and find out and get back to your patients. So this process of practicing what little that you know, and then researching so that you notice that there are certain gaps, and then go and learn more. So it's really important, not just sexual information and knowledge, but actual communication skills with practice can get better. It's also important as a person to start to know yourself when it comes to sex. What are some sexual behaviors and practices that you would say yes to, maybe to, and no to? So the things that you want to do, the things you will do, and the things that you will not do. And it's not really about judging yourself, and it's not about placing it in a place of right and wrong, but rather knowing yourself, knowing your sexual boundaries can be useful in understanding where you stand. When you're clear within yourself who you are and what you stand for, what you're comfortable with, um, when it comes to certain things that you're really uncomfortable with, perhaps it may be useful to consider giving a referral to somebody else instead, who can actually work with this patient to their best interest. So this is a list of different kinds of sexual behaviors that you could possibly download from the internet. So this is possibly like a list of sex bucket lists. So you could actually Google sex bucket list, and this list would actually list down all the different kinds of sexual behaviors that and activities that people partake in. And so you don't know what you don't know, and some of the things you never even thought of doing this sexually for yourself. It doesn't mean you have to do them, but it could be something that you never even thought of. So something that you may consider doing, you could put in the maybe list. So that over time you begin to become comfortable with your sexuality, not just with where you are at, but perhaps becoming a little bit more adventurous in your personal life. Not that you have to, but being comfortable with your sexuality is a big part of us being comfortable with ourselves as sexual people. So in practicing, researching, then practicing, who do you practice with? You practice by yourself. If you don't have somebody that you feel comfortable talking to, you can just do some of the processing by yourself. For instance, this yes, no, maybe list that I just talked about. You could do some of this processing so that you become aware of who you are, where you stand. And from there, you can better articulate this if you are called upon to talk about it, if necessary. And of course, some of the good people that you could practice with would be your friends and family. So many years ago, when I was younger, even before I was a sexologist, I have several very close girlfriends. And so I thought about it like, why would I talk about everything with my girlfriend except when it comes to something that is actually really important to me? So slowly I started to talk a little bit about sex. I said, oh, with me and my partner, we kind of, and then I'm thinking this and I'm wondering. So when I started to open up a little bit, I noticed that they started to open up a little bit as well. And soon I realized that actually it did make us feel closer in terms of our friendship. And also, it made me realize by talking a little bit about sex, my friends never even thought that I was bad or anything. In fact, my friends were grateful for the opportunity to talk about sex. And so they know that I'm the one person that they could count on who may not have the answers, but is ready to talk about this topic that a lot of people are uncomfortable with. So by opening up yourself to be available as a channel for your friends and even your family, for instance, like maybe your sister or brother, you become that advocate. And especially since a lot of you watching this video are healthcare professionals yourself, and you do have the medical know-how and information and resources to support people. So just opening that little window for other people gives you the practice that you need to be even better so that you can speak and inquire and support your patients who essentially are strangers. So if you are not comfortable with people who are already in your circle and you're not even supporting the people who are really close to your heart and you naturally want to help, what more your patients. So I would say practice when you can, and be brave and be vulnerable, because it does take courage to start talking about sex, even though you have the fear of being judged. So these are some of the 4 tips that I have for you to begin exploring your sexuality, to overcome your own inhibitions, and then we can talking about sex with your patients. So in talking about sex with your patients, the first thing you need to understand, even though you may not be a sex expert, is that there are 3 main things governing our sexuality. We call it the body, the mind, and the heart. So when it comes to the body, of course, we want to rule out any physical possibilities of why they may be having problems in their lives, for instance, their sex life. So that would be the physical, the biological, and then the psychological, which is the mental, which is the mind, and then the sociological, which involves the emotions and the way you relate with other people. So I usually just call it the body, mind, heart approach. So definitely as a sex expert, I don't examine my patients, my clients. And so as yet in my training, I've learned that I must rule out the physical aspect of the possibility where the physical is causing the sex problem. So you rule out the physical, then you look at the mind, and then you look at the heart. So when it comes to the mind and the heart, for instance, this list of sexual dysfunctions, then at least be familiar with these different terms and what they mean, so that when your patients come to you with sex problems, you know what sex problem they are talking about. So this list actually comes from the DSM Guide 5, and it stands for the Diagnostical Statistical Manual of Mental Disorders 5, and this by the American Psychiatric Association. And this is a definitive book, also known as the Bible of mental disorders, because this is the premise in which mental disorders are diagnosed and which is claimable for insurance in the US in particular. But this is a very serious and powerful book that is being used. And so I've extracted the a list of sexual dysfunctions that they have in this book. So it's really important to start looking into understanding these different sexual dysfunctions. I don't have the time to go into it, but you can easily do a quick Google search so that you can start to understand these different terms. The first one being low sex drive. It's a long-sounding name, but basically hyposexual desire disorder means low sex drive. And if you look at number 6, it's slightly different for females, sexual interest arousal disorder. So the assumption being that the link between wanting to have sex and the ability to get aroused is a little bit different from people with penises and people with vulvas. So these are some of the common treatments when it comes to sexual difficulties. So there's going to see a psychologist, a psychotherapist, a sex therapist, a sexologist. So these are some of the people who may have some expert training in sexual difficulties. And another type of treatment could be hypnosis, followed by group psychotherapy, which means like group sessions. So group sessions are a little bit more uncommon in Asia, I would say, because everybody just feel that they need more privacy and confidentiality. And 4 is very much focused on the behavior therapy. And actually for myself as a sexologist, I focus very much on teaching clients skills so that they can gain confidence and overcome their sexual difficulties. So I would say that I focus a lot more on teaching them skills and techniques, rather than just keep going into psychoanalysis and going into their childhood trauma and all these things. Not that it's important, but I feel that behavior therapy has been very effective in supporting clients to be able to move forward much more quickly. In dual sex therapy, what this means is it's a combination of medication and therapy. So this is where you can have a multifactorial kind of approach, where instead of just using drug therapy, you actually work with somebody who's trained to also talk with the patient. So this kind of triad kind of a relationship can be extremely beneficial to your patient. So it's important in your city that you look at somebody who you could refer clients to, so that they can get the best quality of healthcare that they can. So in this slide here, you can see that I have 5 different assessment tools that you can download so that you can begin to use those assessments tools as a way to start talking to your patients about sex. So instead of being worried that it will come across like intrusive or too forward, just show them this very professional looking empirical kind of study thing, and it's a survey, and so you don't miss out any questions, and you can from that form get a good idea of where your patient is at. So depending on how the session goes with your patient, you may say something like, okay, I feel like I want to understand better about your erection concerns. So I have this erection hardness score, for instance. You can say, I have this score that I would like you to fill up this form. And how about this, we try this, you take your medication, and next week let's discuss this further after you fill out this form. So nurse will pass me the form afterwards. So something like that, so that it allows you to start to broach the subject of sex and also manage your time, such as being able to ask your nurse to administer certain tools for you. In communication, you can actually look at some of these things. How effective are you in using open-ended and closed-ended questions? You can use scale, for instance, on a scale of 1 to 10, 10 being the highest. How happy are you with your sex life? So without using the assessment tool, you can already begin to start a dialogue around sex. And you can also come up with code words, like when it comes to, for instance, pain with your patients, you can say red, yellow, green. When you get into discomfort, and you start feeling nervous, you can put up your hand, you can say red, and I'll stop immediately. So by implementing these code words, you can be very sure that your patient feels comfortable with you to maybe be assessed physically, or perhaps to start talking to you about what people consider a sensitive subject, aka also known as sex. These are some professional associations that you may want to follow. For instance, their newsletter. You may look at their work so that you become more informed about what are some of the sex research that's happening around the world, so that you become more educated. And over time, you can become more experienced and more comfortable with the subject matter. So over time, you can also become more familiar with the different types of sexual dysfunctions. And so you can provide better quality of care to your patients, essentially. So on ending, I want to bring you back to what I was starting to ask at the start of this presentation, which is, instead of looking at what's happening in your hospital and in your clinic, what do you need to adopt in terms of your qualities and behaviors, so as to determine sexual health for your patients? How can you, instead of looking at other people, how can you begin to take small steps to support your patients in identifying their sexual needs and aspirations? And how are your, not other people, but how does your personal beliefs and experiences now inform or interfere with you supporting your patients? So let's start looking into these kinds of questions, and start to see that this is important for other people. Maybe it's not important for you, but it does affect their happiness or unhappiness. And just take small steps towards becoming a better practitioner for your patients. As a society, it is true that a lot of us didn't get any sex education growing up. We do need more information. We need facts. We need to know more. We need to also be able to offer options to our patients. For instance, if they ask us what kind of lubricants are out there on the market, we can actually get more informed. Then there are techniques we can teach them. And then we need to be honest with them as well, because they trust you. That's why they come to you. And so when you have a rapport with your patients, they want to know the answers from you. What you have to say is important to them. And so you can make a difference to talk about sex when you talk about sex. And we can make a difference as a society, as a medical industry, to start talking about sex. And so this is my contact. If you have any questions, I'm happy to answer those questions and support you in better supporting your patient. This is something that I'm very passionate about, because I have been talking about sexuality in a lot of medical conferences throughout Asia over the almost 10 years of practice now. And I want to support you as well. So if you have any questions, any things that came out in this webinar that I can be of service to you, please reach out to me. I'll be happy to address them. So this is Martha of Eros Coaching. Thanks for watching this webinar. I know it's a bit quick, but I hope you'll be able to see the slides, and you can always reach out to me if you have more questions. Thank you very much. Try to figure out how to stop. Okay, so thanks. Bye.
Thank you, Dr. Lee. It looks like we have a few questions here. I'll send them to Dr. Lee. You can also contact Dr. Lee at the address shown on the screen. This webinar will be posted on the Managing Elderly Care website and YouTube in a few days. By the way, can I invite you to the Managing Elderly Care Conference in Manila on the 14th and 15th of March 2019? Our Pioneer registration offer has 6 huge benefits. Details are shown on the screen. Dr. Lee will be speaking at the Manila Conference on the topic Benefits and Myths of Sex After 50, a sexual function assessment tool for clinicians and caregivers. Have you entered the Asian Elderly Care Awards 2019? Please visit www.managingelderlycare.com. Thank you everyone for attending today's webinar.